Promising Practices for Health Equity podcast, brought to you by the Interdisciplinary Research Leaders Program, a national leadership program of the Robert Wood Johnson Foundation.
Hello, and welcome to Promising Practices for Health Equity, the podcast created by the Interdisciplinary Research Leaders Program, affectionately known as IRL. I'm Crystal Lee, and today my co-host is the incomparable J. Robin Moon. Hey, Robin.
Hi, Crystal.
Robin, I'm so excited today to have Bonnie Cluxton and Andriana Abariotes with us today. Welcome, Bonnie and Andriana.
Thank you.
Thanks. It's great to be here.
Bonnie, can you start off by just introducing yourself briefly and telling us about how your professional journey brought you to IRL? And then we'll kick it over to Andriana afterwards.
Sure. So I am retired from Academy Health. I was a vice president there where I worked on a number of Robert Wood Johnson Foundation grant programs. And I came to IRL, I think it started in 2016. The University of Minnesota was looking for partner organizations to help support a new change leadership program being funded by RWJF. And they reached out to Academy Health, and we joined the team then and have been with the IRL program ever since.
Thank you. And Andriana, tell us about yourself and how you became associated with IRL.
Sure, happy to. And since this was some time ago from the very beginning, I'll just give a little bit of background maybe. So I was the director of the Twin Cities program of LISC, the Local Initiatives Support Corporation. And LISC is a national community development intermediary. And we had been working alongside a number of health systems here in the Twin Cities region, including Allina Health, which was kind of one of the very earliest anchor institution activities where they were connecting community development and community health and health practice there. So in that role at LISC, we were an investor in a lot of the community work that was happening in and around the hospital system. And I had been part of the Backyard Initiative, which was driven by Allina. And Jan Malcolm, who was kind of an initial applicant and then co-director, she became our Minnesota Commissioner of Health shortly after that. But she and I had been working around that table, and the opportunity for IRL came together. And so she had invited both myself and LISC to be at the table as a community partner, both to leverage our national platform, as well as kind of to go and do a deeper dive in the work that we were doing in community. And then just by happenstance, LISC and the Robert Wood Johnson Foundation were working alongside the Federal Reserve Bank to try to foster healthy communities conversations. It came from two different directions, and it was perfect timing to think about how to leverage this opportunity.
You're the earlier model of community leader of IRL, so it was a really important background that you gave us. Thank you for that. So before we get started, we invite you to check in with us. One of our core beliefs is that nurturing personal relationships is key to building the kinds of communities that collaborate effectively in the work toward health equity. So at the beginning of our meetings at IRL, most of the meetings, we do a quick check-ins to help us set the ground and continuously build connections in our team, our beloved community, as we call it. So here's our check-in question for today. If you could time travel in the US, which period or decade would you choose to visit first? So I thought about this a little bit because it's my question. Provided that I can come back to where I am, I would go back to the roaring 20s, 1920s, right after the influenza pandemic. I read relatively extensively about how all these great things happened. Things just flourished and bloomed after a horrible pandemic 100 years ago. And right now, I'm not really feeling like that is what's happening. I would like to learn how it happened and what happened exactly so I can bring it back to today and apply. Okay, I'm going to toss it to you, Crystal.
I took this question a little bit differently. I think that I would go back to when indigenous people were in charge of the United States, known at the time as Turtle Island, and I would tell them not to be so nice to the visitors.
The agent from the future.
Think about this, like you need to be a little careful. I think that's what I would do. I'll toss it to you, Bonnie.
I took even a different approach to this question. So I would go back to a time before cell phones. I've been thinking a lot about family vacations where my many nieces and nephews would play wiffle ball and we'd have big family dinners. And now to get them to look up from a cell phone is excruciating for them. I miss that time with more one-on-one communication.
Excellent.
I kind of went where Robin went a little bit, but for a different reason. So my grandfather immigrated to the United States right at the turn of the last century. So it's hard math, but it works since my grandfather was 60 when my dad was born. So he was born in the late 1800s and had immigrated in like 1910. And so I'm just curious about what that experience would have been like coming to the United States, trying to become established. He sold candy at fruit stands and then ultimately became a candy store owner over time. It was like that whole story. And so I think about the community development work that he was doing before it was actually named. It was like, I think that's what's in my blood. And I think that's why I do the work that I do. So I would just wanted to see what that world would have been like for him and my kind of immediate ancestors.
That was a really fun answers, all of you. Thank you for sharing. Okay, now let's talk about IRL. From your own perspective, tell us what you remember about the original vision of IRL at the time of development, so 2014, 2015. Because you were both involved from the beginning, relatively. What were your motivations and hopes for the program? Andriana, do you want to start?
Sure. So as I had mentioned, I had been around the table of the Backyard Initiative with Jan Malcolm, who was one of the original co-directors. And what was really interesting about what we were doing at the Backyard Initiative was this was after at least a decade of investment that the health system, the city, and the county had done together to improve the physical environment. So a lot of the neighborhood revitalization work in and around hospital institutions had everything to do with affordable housing and workforce development and other forms. And so then Alina, in its next iteration, was doing this Backyard Initiative. And the community just completely revolted and said, hey, wait a minute, you're in our backyard. Let's try to have a different conversation around health. And so we were working with an organization, a very rooted community organization called the Cultural Wellness Center, who was facilitating those conversations and really kind of turning the conversation around health on its head. And I think it was a powerful example of when you engage community and really take the time to listen and learn that there is a different way of getting to kind of answers in a community, solutions in a community. And so I think it was kind of from that table and that experience, it felt like the opportunity for IRL was perfect timing to be thinking about how communities could partner with researchers, whether they were university institutions or think tanks or folks who had the tools and the skills around using data and research and the exploration for the information that communities need, whether it's from trying to get a great handle on a needs assessment to, in a lot of cases, nonprofit organizations and communities have to deliver research on impact and evidence-based practice and the like for resources. And so it was like, how could we really leverage this opportunity to develop those relationships? And I think it was coming with that spirit and thinking about how might we be able to inform the practice, not only for our own backyard, but for communities that were experiencing similar situations across the country.
That's fantastic. I started 2020, so often thinking about this program initiated by Robert Wood Johnson Foundation that does a lot of research. The research part of the IRL tends to come out first as like maybe the motivation or like the goals and objectives, but you totally gave me an entire different orientation. Thank you for that. Bonnie, how about you? The original vision of IRL and your motivation and hope for the program.
Sure. So coming from Academy Health, which is the professional home for health services researchers, I thought a lot about what we do, what we did there, what it currently goes on at Academy Health. It's a lot about translating evidence into action. And so when we were at that first meeting at RWJ, what I was thinking about was the fact that this was a different model. These were teams of researchers and community partners working together on community-based projects. A little bit different than what I had seen in other RWJ grant programs where you see typically researchers in an ivory tower crunching data. And so what we were asked to do was develop a curriculum focused on policy and communication training. And at the start, we had to think about what does that mean when the research team is really embedded in a community and the team members are co-equal partners, researchers and community leaders. And I don't know that I had an expectation at the time, but it was exciting to think about a new model of research.
Thank you for sharing all that context. It really helps me we had a conversation a couple of weeks ago with Nancy Fishman from the foundation, who was the program officer at the time. And we're gathering, as someone who started in 2021, like the program was well on its way. It's really good to hear about how these different people from different walks of professional life and so on, how everybody came together to form this program and to do it in such a different way. So to see the evolution of how research happens in the community and as part of the community, how that has changed. So I wonder if you could also talk to us about how you, while you were with the program, how you saw the program itself evolve and how this evolution of the program came about. Let's start with Bonnie.
It was interesting because there was definitely an evolution in the way that we conducted the policy and communication training. And really that was informed by the teams themselves. I think when we started, again, we had that traditional research model in mind. And so we convened panels of very traditional federal policymakers. And as time went on, the teams were reminding us that it would be most helpful to hear from folks who better represented their communities and the work that they were doing. And so we expanded our meeting to include not only federal policymakers, but state and local policymakers, community stakeholders. We had a panel of journalists, terrific folks from a national newspaper, and realized that what we needed to do was broaden that to reporters who worked at the local level, at the state level. And rather than just have panels where folks talked at the teams, we developed a program called Small Group Discussions, where we brought in members of the community, folks from the community working on projects similar to what our teams were working on, to have conversations and to talk about challenges, objectives, and the work that the teams were doing. So it was an evolution in the way we structured the program to better meet the needs of the teams.
Andriana, in your time, how did you see the program evolve?
Well, and I really appreciate what Bonnie was saying, because I took a lot from those sessions. Those were great, right? Like, so I think both researchers and community partners got a lot out of the policy and communication, especially working with journalists. So I was thinking back to this. So IRL and Robert Wood Johnson Foundation, we were both building the plane as we were flying it, right? Like, so it really felt like it was quick to kind of stand up with some kind of core principles, values, what we called pillars, right? And it was great to go back and look and see like, oh, those are all still the same pillars. So we were right in the beginning of thinking about what were going to be some of the biggest challenges. So thinking about collaboration and the tools for collaboration and the practice of collaboration and how hard it is. And we saw that play out multiple times in and amongst teams across the program. I think those were similar themes that were coming up in the other national programs that RWJ was supporting. The whole process of change leadership, I think, was more of an intellectual exercise in the beginning. And it was like, no, there's a lot of tools that I think even the researchers began to think about their own institutions as change management, right? I think there was a lot of, let's build a lot of skills, let's do a lot of conversation and webinars and mini course so that people had tools. And I would say that maybe over time, what really became most effective was creating space for adults to learn together, which is really a lot of peer-to-peer. It's a lot of conversation. But as a program, when you're really trying to entice people to make an investment of their time and effort, you want to make sure you're like providing value. So you can't just say, oh, well, we're going to have 3 years of open-ended conversation, right? We had to have some structure to it. So I think the pillars that we kind of established around collaboration and community engagement, around the policy conversation, how to disseminate, and even having a research project, I think very ambitious from the very, very beginning. Maybe that has evolved over time so that people just know how to work together to ask the right questions, to understand community context, to embed health equity in the conversation. In a lot of ways, from those very early conversations, I don't know if health equity was on the list or at the table, but it became quickly evident that was an important piece that had to be quickly built and supported and understood. That was going to be a key piece of the conversation to do this work.
Andriana, you already got into the conversation, the question I'm going to ask. So we've heard from others so far through this podcast recording that there was an intentional prioritization of communities and community organizations, or even researchers from the academic institutions to think about how to orient communities in the center of their work through the IRL program. With the benefit of your experience at IRL and all your career, can you share with us how your concept of community engaged research might have evolved? So it's a similar question from before, but drilling down specifically to community engaged research. What lessons have you learned about how to execute this well?
Well, I think it's always something that I'm learning, right? Like, I don't think there's an endpoint to it. So, but I think as it's evolved for me, coming into the program and just even my own experience, there were tensions, what it means to do community work, period, right? So I think on the one hand, kind of neighborhood and community population level, when we're trying to think about population health, neighborhoods are great organizing kind of scales, right? To kind of go deeper into. But, a neighborhood isn't necessarily the only way you define communities. I think there's multiple communities inside communities. And so just really being able to kind of say, well, how are we defining community and how do we wrestle with what that looks like from the research perspective was something that was also a through line, I think, from those early days of IRL and probably continuing. When I think about community work, there's a lot of ways that it can be structured as people-oriented or place-based or somewhere in between or some combination of those things. And so when there's a couple of different adages that I've heard for many, many years. It's if it's about us, but not with us, it's not for us, right? So like that really what comes through with community engagement and community engaged, community-based participatory research for sure. But there's also a tension kind of in community development work where if you focus on people-oriented strategies or interventions, oftentimes people improve their lives and move out of neighborhoods. Simultaneously, if you only focus on place-based activities, you make investments and you force people out. And so it's like holding that tension, I think, becomes both important from a community investment and community development kind of standpoint, as well as a community research kind of perspective as well. And so I find that in all of that work for me in my career, there's an immediacy when working with community, whether you're working individually. My most recent position was with a large scale nonprofit organization providing affordable housing and supportive housing being a key piece of that. It's a day-to-day experience. And so the immediacy of even trying to engage residents or develop a resident survey is something that has to be so relevant in the moment, and creating space where you're playing kind of a short game and a long game simultaneously. And so just thinking about, well, how does research then kind of intersect with that is like a really interesting question that I don't think I've found a great answer for, but I definitely used a lot of the experience at IRL thinking about like, how do I guide evaluation work for this organization? How do I think about the infrastructure that's needed for resident surveys or other kind of continued work? So I just hope that's what a lot of the folks who were participating in IRL are taking with them, especially from a community partner standpoint. Like, how do I think about that infrastructure and those relationships that kind of continue this work over time?
Thanks for that context, Andriana. Several things that you said made me want to ask this question of Bonnie. So it's about the ways that we communicate what we find in this research to try to get it back to the community that's served as kind of however we're defining community, right? That's kind of served as the location for where this work happened. And I'm curious about whether or not, like, how much you can talk about the evolution of the ways that we communicated those results. So I know we started with research briefs being the primary means of gathering and sharing the information, but how has that changed over time?
That's a great question. It did change significantly. And picking up on some of Andriana's points, we had to really think hard about the fact that these teams were in community. The community partner was so critical in terms of being oftentimes the better messenger when we wanted to share findings. And so, as you said, Crystal, we started with training on how to develop a research brief, but heard from the teams and soon realized that is not an effective mode of communication for a lot of these teams who want to reach a school board or a tribal leader or a barbershop owner. And so we expanded the curriculum to include development of op-eds or podcasts or PowerPoint decks, and brought in folks like Jonathan Schwabish at the Urban Institute to help train the teams on data visualization. Because as we worked with the teams, we tried to really impress upon them that the work that they were doing was going to be most effective if it could be communicated to the right stakeholders using the right means. And we worked with them to develop social media platforms and asked them to really think hard about who their stakeholders are and how best can you reach them.
Thanks for sharing that, Bonnie. And I know that in the last year or two, that evolution has continued, right? To where we have offered even more opportunities or different ways of sharing our information, our findings from our research. So thank you for sharing that.
Also, Andriana, the way that you put the tension between the people and place, that is not something I like. Community development, you are the true community developer. And I have heard outside the public health context, that tension, and that's a big tension and then great tension to think about and work with. But generally in public health world, I find, at least from my world, people tend to be defined by their disease condition, disease state, or health condition. And the place concept, the physical place-based strategy and concept do not really get in the conversation. So that was a really great reminder. Thank you for that. We want to now ask you about promising practice. And this is not necessarily the best practice. This is not the go big or go home kind of practice. We want to hear from you, looking back at the last 10 years of IRL while you're involved and including the time you're involved. What are you most proud of? Give us an example or two of promising practices for health equity that you want to share with our audience that they may go replicate somewhere else.
The research teams would begin their time at IRL by developing their research plan. That was one of the early steps as they started their work. What we asked them to do is to simultaneously develop a dissemination plan right at the start of their work. Oftentimes, if you think about traditional research, research team does a study, 3 years goes by, and then they start thinking about which journal they're going to publish in. That wasn't going to work in this model. So we asked the teams to develop a research plan right at the start of their 3-year time with the program, and so that they could think about who their stakeholders were, how best to communicate with them, and have that top of mind throughout their entire project. And I think that in that way, they were able to connect with journalists, with policymakers, with other stakeholders throughout the process, develop those relationships, and then effectively communicate the findings from the work that they were doing. So I think, again, starting that dissemination plan at the start is a really great practice.
And I totally agree. Andriana?
Yeah, I think there's just a fundamental opportunity for relationships and building kind of the skill sets and the set of relationships that you need to do this work. And as I think about the community partner role in particular, there's so much work that is always just right in the immediacy of like what's right in front of me right now. Right. And so the IRL experience, both in the local research opportunity and the broader programmatic and national conversations, just lifts you up out of that immediacy of that day to day, to be thinking differently, to be developing those relationships, that to be thinking about policy work when so much of that might be immediate service delivery or some level of practice. That just even in that, I don't want to lose sight of just the value of the space, and the opportunity is one of its most promising aspects. I do think, like, the ability to be thinking about what's the end to this conversation and the dissemination being an important piece of it. I think that beginning kind of river exercise, or that river of life exercise, where people really figure out what's my tributary that kind of rolls into this broader movement. And so whether that's for each individual team, or as the teams got to hear each other's stories come together and the cohorts, that to me was always something that I really looked forward to learning and seeing how people devise that element of the story and the collaboration.
Perfect. Thank you all so much for sharing. I think that one of the reasons that we wanted to do this podcast is to illuminate some of these practices so that others can think about how to do the work for health equity in ways that have been effective for us and may be effective for them. So thank you for highlighting those. One of the books that we've engaged with in the program over the last couple of years has been Emergent Strategy by Adrienne Maree Brown. And one of the quotes from that book that really sits with me is the fact that Adrienne Maree Brown says, "All that you touch, you change, and all that you change changes you." So I want to invite you to share with us, what do you think that the impact of the IRL program has been on you, and how has your involvement with the program changed you?
That's great. One of the things that we talked a lot about with the teams was the value of storytelling. We would often say data makes you credible, stories make you memorable. And what has changed for me is really the impact that teams like IRL can have within a community. These teams were so passionate and are so passionate about the work that they do, and you can have an impact that is so fundamental, and it was just amazing to me to watch the enthusiasm among the IRL teams for the work that they were doing.
Yeah, I think there were a couple of things. Part of it was just even having the experience of connecting with health. So whether it was healthcare practitioners or public health practitioners or folks who were talking about community health, for those of us who come from the community development realm, it was very easy to think about in physical capital and economic capital. And a lot of the conversation early on that I mentioned at the beginning was that, like, how do we get healthcare investing in affordable housing and community development, right? Like it was almost a monetary kind of exploration, because the Affordable Care Act had passed. We were going to move from volume to value, and community developers were like, hey, we're ready to like help you with social determinants. And then a lot changed, but the challenge still remains. But I think understanding the importance of human and social capital, particularly the social capital, because that to me was a lot of the conversation around social isolation, around mental and behavioral health, and the intersection of when people and place-based strategies, right, like IRL became this place where that meeting ground was happening. And so for me, that was really powerful to see and to learn from, and not to say that we didn't know human capital and social capital weren't important, but like just how important and how to really leverage kind of those conversations in important ways to do, whether it's community development and community building work or community research work, I think was really important.
I just want to note that every episode of season 1 so far, we're talking about a research program. Not a word of method has been mentioned. It almost always ended with relationship and people and social capital. Just noting that. It's wonderful. It's time to wrap up our conversation already, and we're going to do a checkout together. So this checkout question goes to all guests that we have for our podcast, which is the work to achieve health equity can be very draining to the point of being unsustainable. I think we all know that. Can each of you share the strategies that you use for yourself to find rest and engage in self-care?
I am a big proponent of walking. I find I do my best thinking when I walk, and it's also a great way to relieve stress.
I was able to kind of build a meditation practice during all of this. And I think particularly when 2020 came around, so when I was co-director in 2020, a lot was going on, especially here in the Twin Cities. George Floyd was murdered. We were completing a selection process that week. And I think the level of trauma that was being experienced here and across the country, certainly, but like just, it was so intense trying to figure out how to navigate any and all of that and make sense of that. I think just being able to kind of step back and quiet and go to a place where meditation, like, I think was the only thing that helped me. Walks were also good and continue to be good, but like that practice of mindfulness and meditation, I think, is underrated, and I would encourage everyone to try it.
Great, thank you.
Thank you for sharing, Bonnie and Andriana, and we're so grateful for the time that you spent with us today, illuminating your experience with IRL and helping us to learn more about the program and how the program evolved over time. We really appreciate your time. So thank you for joining us, and thank you to our listeners. As always, we want this to be a two-way conversation, so we would love to hear from you. Please share your thoughts with us via our LinkedIn page, where we will also be posting our show notes and any resources discussed in our episodes. And don't forget to subscribe to Promising Practices for Health Equity so you never miss an episode. You can find us on Apple Podcasts, Spotify, YouTube, or wherever you get your podcasts. Thank you for joining us today. And remember, we're all on this journey together, and every step we take together brings us closer to a healthier, more just world. Until next time.
Promising Practices for Health Equity is produced by the Interdisciplinary Research Leaders Program, a national leadership program of the Robert Wood Johnson Foundation. A special thanks to our guests, our production team at Studio Americana, and to you, our listeners, for being a part of this important conversation.